my name is Whitney and I'm a registered dental hygienist here to help you confidently choose the best whitening toothpaste from the overwhelming options in the toothpaste aisle. Before we get into it, it's important for me to say that whitening toothpastes can be a great preventative tool to keep your smile bright by minimizing new stains from forming. However, they're not a miracle worker for removing old stains or dramatically lightening your teeth. For actual teeth whitening results, getting your teeth to look shades whiter, a toothpaste isn't going to do that for you. You'll need whitening products like strips, gels, or trays. I'll link that video of mine below if you'd like to learn more. But if you're here to learn about toothpastes to brighten your teeth by reducing stains from forming, then let's talk. To make it easier, we will call them whitening toothpastes throughout this video. But again, although that's the name, I just want to reiterate that they don't technically whiten teeth. They just can brighten them by reducing stains from forming. Okay, so I tell my patients the two main things to look for in whitening toothpastes are: one, does it contain peroxide, hydrogen peroxide or carbamide peroxide? Because that's the main teeth whitening ingredient that exists. And two, does it contain any abrasives, such as calcium carbonate, hydrated silica, sodium bicarbonate, aka baking soda, dicalcium phosphate dihydrate. There's a bunch of abrasives that can be listed as ingredients in toothpaste. You don't need all of them. One abrasive is sufficient, or just peroxide is fine without any abrasives. But having both a peroxide ingredient and an abrasive ingredient, that's what's going to give you a truly brightening effect. Now, I have to say, while these abrasives are effective in combating tooth stain, the overuse of abrasive toothpastes or improper brushing techniques, such as using a hard bristled toothbrush or scrubbing too hard, can wear down enamel over time. So always use products with abrasives as directed. Read the directions on the tube. You'd be surprised how some of them actually say to use only once a week instead of daily, and then to use another toothpaste for your daily brushing. Overall, always consult your individual dental provider for advice tailored to your health. Having said all of that, I don't usually recommend specific brands to my patients. I mean, I will link some that I like to use in the description box below. This is not a sponsored video. They are just some of my preferences, and maybe some of you will like to use them as well. But if you learn anything from this video, remember that when you're in the toothpaste aisle trying to find out which toothpaste is best for you, if you don't want to be looking through all the ingredients listed on the tubes trying to figure out what's what, a simple way to know if the toothpaste does what it claims to do is to look for the ADA seal of acceptance. This seal means the product has been clinically tested to ensure it works, to ensure that it actually does what it says, and that it includes the ingredients to help whiten or brighten teeth, if it says that that's what it does on the tube. So I love that. Easy hack. Easiest hack, honestly. The ADA seal means it does what the box says it does. However, the ADA seal takes a few years to earn, so if a product doesn't have it yet, it doesn't mean it's bad. It doesn't mean it doesn't work. This is only for if you want guaranteed results. The seal is a great indicator. It makes it so easy to choose a toothpaste without having to try and decipher all the ingredients, and that goes for all types of toothpaste. If it says anti-cavity or if it says anti-sensitivity, if it has the ADA seal of acceptance, then you know it does what it says it does. Now, again, if the product doesn't have the ADA seal yet, then you want to be looking for those key ingredients, including some type of peroxide and or abrasives, those ingredients we just talked about. And lastly, as a dental hygienist, I have to say cosmetics are not the priority with dental health, right? Of course, lots of us love to have bright smiles, myself included, but it's important that on top of your teeth looking nice and bright, that they are also healthy. So when you're getting your whitening, brightening toothpaste, always make sure, in addition to the whitening ingredients, it also contains an anti-cavity ingredient in it as well. Fluoride and nanohydroxyapatite are two anti-cavity ingredients, and I highly recommend your whitening toothpaste has at least one of them in it, because without cavity protection, you can have nice bright teeth until they aren't nice and bright anymore because you start to get cavities. I bring this up because lots of Instagram trending type toothpastes have been advertising themselves as whitening toothpastes, but they are often missing anti-cavity ingredients, and I've seen patients who have switched to these trendy toothpastes just to come to the dentist 6 months later and find out they have cavities now and never had cavities before type situations, when someone didn't even realize the toothpaste they started using that they bought on social media doesn't contain any anti-cavity ingredients. That is so unfortunate, right? So don't let that happen to you by either one, always making sure your toothpaste has the ADA seal of acceptance on it, or two, asking your individual dental provider before you ever switch toothpastes to make sure it's a good one for you, and three, if you want to learn more about anti-cavity ingredients and how to decipher all of those ingredients, I will link those videos of mine below as well. But for the purpose of this video, just remember the whitening ingredients are peroxide and abrasives. And as a dental professional, I recommend if you use a whitening toothpaste, make sure it's one that also contains an anti-cavity ingredient. I recommend fluoride since fluoride will strengthen and remineralize your tooth enamel, thus making teeth less susceptible to enamel damage. If you don't like fluoride, nanohydroxyapatite is the second best alternative, but it's still not as good as fluoride in protecting teeth in acidic environments. Again, all those videos of mine will be linked below if you'd like to learn more. Oh, one more thing. If you're thinking of making your own DIY toothpaste at home with lemon juice and charcoal, things like that, please think again, especially if you want to not damage your teeth. Lemons are acidic and give you cavities. They are not going to whiten your teeth. They will only increase your risk of tooth decay. Charcoal is extremely abrasive and damaging to your tooth enamel, and enamel does not grow back. So you don't want to be scratching layers of enamel away daily with charcoal because sure, each layer might look bright, but then one day you'll get to the bottom layer under enamel, which is yellow. So you don't want to be brushing your teeth yellow, damaging your teeth in the long run, especially if overused. So yeah, any of those gimmicks you've heard of, purple toothpaste, turmeric toothpaste, etc., if they sound too good to be true, they probably are. Overall, you want ADA approved, and if it's not ADA approved, check the ingredients and always ask your dental provider and keep them in the loop whenever you switch toothpastes. One more thing, PSA. If you have sensitive teeth, whitening toothpaste will only make your teeth feel more sensitive. So be prepared to discontinue use if it worsens your sensitivity. I'll also, of course, link my sensitivity toothpaste video below. In conclusion, whitening toothpaste is more of a preventative tool to avoid discolored tooth enamel versus getting rid of it. Whitening toothpastes can help to brighten your smile because they help prevent new stains from forming on your teeth. However, they won't remove old stains from your teeth. To get rid of old stains, you would need to get a teeth cleaning at your dental office, and then afterwards, you could consider using whitening products such as strips, gels, or trays. All my supplemental videos, information, and sources are listed below. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want to learn more about ways to keep your teeth healthy at home with proper brushing, proper flossing, so many people unknowingly floss incorrectly. I'll link my free oral care guide below to help you learn proper technique and ways to better your mouth, to not only keep your teeth looking white and bright, but to also keep them healthy. So until next time, I'll see you on Instagram at Teeth Talk Girl. And peace, love, and teeth.